stretching, this separating of your abdominals is called diastasis recti, and it's actually a really normal process that happens during pregnancy. And despite what social media maybe made you feel, you didn't do anything to cause it. And there's a lot of fear around exercises like planks and sit-ups and crunches that we're told like absolutely do not do those. But we don't have a lot of evidence to support that doing more of those things makes your diastasis worse. There's so many other factors that go into it, and we're still trying to figure that out. Now, one thing we do encourage to help with the healing in terms of how your abdominals are working and supporting you and preventing any other things that are happening because of that separation, like back pain or bladder leakage and other issues that come from poor pressure management. And a big piece of that is learning how to engage and wrap up your deep core muscles and really use your abdominal muscles as a whole versus always just pushing and depending on, those six-pack muscles where that separation is happening. And planks and crunches and sit-ups, those are movements that really put more strain on that tissue, which doesn't mean it's a bad thing. It just means we might have to work a little bit harder to manage that pressure to avoid pushing that excess pressure on that tissue that might be a little bit more vulnerable. One of my best tips is to learn how to properly engage your deep core muscles when you're doing things like planks and sit-ups. And don't fear doing them because those are the movements that are going to help strengthen that tissue. We just want to do it in a progressive fashion where we're not going all out and trying to do these really hard, high-level core exercises that maybe those abdominals can't handle that much anymore. But you can get back to doing those things even if you have a little separation. Another type of core movement that I really like to add in with clients who have diastasis recti and want to help create more tension through that tissue is rotational movement. So really getting those obliques involved, those cross-body patterns, and that can help create this really good tension and force redistribution across your core that helps manage pressure a lot better. So planks and crunches and sit-ups are not bad exercises, and you can get back to doing those, but also include other movements like rotational movements. What questions do you have about diastasis recti?